As a part of your protocol, your doctor has instructed you to use Gonal-F, and you've purchased a Gonal-F 75 syringe. We're going to show you how to mix and prepare for injection. This stays at room temperature, does not need to be refrigerated. Everything that you need to mix and inject comes in the package. You'll start by opening the plastic, and you'll see that there are the vial with the medication inside of it, which is a white powder. There's a syringe that has clear fluid in it, which is a diluent. There's a big needle that we use to mix it, and there's a smaller needle that we will use at the end to perform the injection with. To start, you will take the white cap off of the top of this syringe, and the way to do that the best is to sort of hold the bottom and then push with your thumb up here, and you'll see that it pops off the top. Then you'll open the needle. The pink part twists on to this white part. Just hold it so it gets on there nice and tight. And then you'll pull the lid off the top of the needle. Again, we're not injecting with this needle. This is just for mixing. It is big, don't let it scare you. Then you'll put the needle into the vial and push all that fluid into the vial, and it will mix together with the white powder. So now you have a clear fluid mixed with your white powder, and then you'll turn that upside down. In this gray area, you can see the needle tip right at the bottom in the clear fluid, and you'll just pull back on the syringe to get all of that fluid back into the syringe down here. And you'll just keep going until as much as you can get out of that vial is out of it. Then you'll pull it off and pull back on the syringe so there's a little bit of air at the top here. And now we're gonna switch needles. So you can put the lid back on the top of the needle carefully to make it easier to get it off. And then you'll twist so that pink one comes off, and you'll put the needle for injecting on. This time we're gonna twist this red on to the white holder, hold it tight, twist it in nice and firm. And then you can take the lid off of that. You'll use your plunger to slowly push up and get all of that air out of there until you see a little bleb of fluid come out the top of the needle. And now your injection is ready to go. Next, watch a video that helps you understand how to landmark and perform a subcutaneous injection, which you'll use with your Gonal-F 75. Now that you have your medication prepared, here's a video on how to perform a subcutaneous injection. First, these injections are going to go into your abdomen. So you'll pick a spot 2 fingers away from your belly button and inject anywhere in your tummy. The injection is going into that fatty layer of tissue right under the skin. So 2 fingers away, anywhere in your tummy, just like this. When you're doing your injections, you'll pick a spot and then you'll rotate your sites. So try not to poke into exactly the same spot as you did already today or yesterday. Try to rotate the spots a little bit, even a finger away is helpful. When you're ready, you'll use an alcohol swab to clean the area that you're going to inject into. And then you'll give that a few seconds to dry. You'll take the cap off of your prepared needle and pinch your skin where you're going to do the injection. You'll inject at 90 degrees all the way in. Push the plunger on the syringe down until all of the medication has been delivered. Then you can relax your skin and pull out the needle. A little bit of blood, a little bit of liquid might come out. That's okay, it's normal. You can use a tissue to hold the spot until the bleeding stops. And then when you're done, make sure that you put your used needle into a sharps container or your medical waste bag.